The current focus of technology-enabled care is really now moving into mainstreaming and adoption at scale. So having shifted over the last few years from testing, projects, helping create the conditions, we're now at a point where there's a focus on a few large-scale programs to really business as usual integrate with the way people are working. So in terms of our direction of travel, that's what work is in progress. I think the other, area linked to that is how the technology-enabled care programme supports the service transformation domain set out in the digital health and care strategy. So that's about, again, trying to ensure that we're building on the work we've done to date, but really trying to ensure that it does inform that service redesign and service transformation that's being taken forward by our health and social care partners. Events like the Early Network Day are hugely important. You know, I think we get so much energy and enthusiasm brought together. I think hearing what's going on in other parts of the country, that sort of knowledge exchange, that networking, I think we've all picked up sort of new snippets of information today, and I think we get increasingly that range of sectors, organisations and disciplines coming together with a real focus on how can we improve outcomes for people. And this year I'm particularly pleased that we've had our Young Scot delegation here. So we've had a panel of young people that have been working with us on the technology-enabled care programme. So again, it's trying to ensure that the conference is accessible and open to hearing about the views. And I think we also have an element of international European connections as well, which I think is hugely important. Sometimes when you're in it and you're doing it, you're maybe not as aware of where you've come from. So I suppose backtracking 5 years ago, I think we were at a fairly early stage around looking at some of our technology-enabled care approaches. We had very small-scale projects, but now I think a lot of those have moved into much more of what should be business as usual. I think we also have an ambitious strategy, which we didn't have 5 years ago, and it's brought together what was under telehealth, telecare, technology-enabled care, e-health, information. So I think we have a huge opportunity, and I do feel we've now got strong national leadership across Scottish Government, NHS and local government. I think we've got good engagement from third sector, independent sector and the housing sectors. I think we need to do more on the public engagement and public awareness of how digital can support their health and well-being. I think we've got some examples of that, and this year we're running our second Discover Digital public-facing event in October. So as I say, I think we've come away. I think we've more to do, but I guess we're always looking to reach that third horizon. But I'm pretty confident that we've got reasonable pace now, and I think we do have good leadership at national and local level, and always challenges around resources and capacity. But I'm confident we're heading in the right direction. Yeah, I think there's various approaches taken to how we scale up. So I think one is our mantra, sort of once for Scotland. So can we do something once? Can we identify, the evidence? Can we look at creating the sort of models and the pathways and disseminate that and support local areas to adopt it, obviously contextualising as appropriate to their local situation. So I think that Once for Scotland approach, I think, has been a strong driver with what we've been doing on technology-enabled care, and again trying to resolve some of the barriers or issues. So for example, the issues we had around information governance and the use of the Florence, let's not have every area trying to work through those issues themselves. Let's look at how we can develop a resource and a toolkit for Scotland.